Welcome everyone today to our Mental Health Matters webinar series. This is the fourth in a series that's been presented by the One Future Coachella Valley's Behavioral Health Workforce Alignment Team. My name is Kim McNulty and I'm Vice President of Regional Strategy for One Future Coachella Valley, and we're delighted to have you here today. The program will be that we'll have about a 30-minute presentation that will give you some background in behavioral health, and we have three great panelists here today to talk about careers and also university pathways to careers in behavioral health. So excited to have you here. I'm going to start off by just briefly telling you a little bit about One Future Coachella Valley and our behavioral health team. One Future is all about helping students in the Coachella Valley graduate prepared for college, career, and life. And in order to accomplish that, we have teams of professionals and educators and community partners who are looking at different aspects of the supports that will help students prepare for those careers. And one of those teams is our Behavioral Health Workforce Alignment Team. We have about 90 partners in the community who work to grow the number of students in our community who select careers in behavioral health, because our goal is to have a next generation behavioral health workforce that is comprised of youth from our community who understand our community and want to come back and serve. So we're delighted to have you here today to explore some of that work. As we set this program up today, we do have a couple of things we'd like to share as far as guidelines. Number one, we'd like to invite everyone to participate. As I shared, we've got some great professionals here with us, and they would love to hear from you. So we'd like to hear your questions and comments. We'll invite you to share things in the chat from time to time or answer a poll. And so please take advantage of that. And the one thing we ask when you're posting things is just that you are courteous and respectful of those who are posting other things in the chat as well. And before we begin, I'd like to introduce two of my colleagues from One Future who are helping to put this together. So Eloisa Lopez, if you could say hello.
Hi, everyone. Thank you for joining us.
Eloisa is helping to coordinate this series and also as a support to our Behavioral Health Alignment Team. And also Ariana Arias, who will be a graduate of UCI in a couple of weeks, and we're delighted to have her as part of our team. So welcome, Ariana.
Thank you. Hello, everyone. Thank you for joining us.
And now I will share with you, introduce you to our panelists. And we are delighted to have three professionals joining us today. Michelle Downs is a licensed marriage and family therapist from Riverside University Health Systems. And Maria Chavez Brown is a licensed clinical social worker, and she works with Clinicas de Salud de Pueblo here in the Valley. And then Dr. Vic Sharma, who is the campus director for Brandman University. And so welcome to them. You'll get to meet them in a moment.
Hello, everybody. My name is Michelle Downs. I am a licensed marriage and family therapist, and I am with Workforce Education and Training at Riverside University Health Systems, also known as Riverside County. I am working on getting this going. And one of the things, and I saw some of the questions that you had there, I want to talk to you about is how is that you come to reach these path in your life. First of all, let me tell you, I wasn't always interested in psychology. I started my life, my professional life, as business management, and I worked for UC Riverside for a very long time. And then one day I decided I wanted to make a change. So just so you know, you don't have to have a bachelor's in psychology to become later on a professional in behavioral health. But if you do, that's great. So some of the things to know about working in behavioral health is that you don't necessarily have to, wait forever. You can start with a certificate, and which you could be like a peer support specialist or a behavioral health specialist. And Eloise and Ariana will be sharing with you some of this information to have more detail about those professions. You can also have an associate degree, a bachelor degree. Then if you would like to do something like I do, which is therapy and other things, you would need a master's degree. And then there's the medical professions or the psychologist professor, PhDs, PsyDs, which require further education. So you would be doing like 8 or 10 years total. But don't get scared about those numbers because it doesn't have to be, overwhelming. You can start at one point. So one of the things to understand about behavioral health or mental health is that there are different options, right? So in medical careers, there's where the psychiatrists, nurse practitioners, vocational nurses exist. And the difference with the allied mental health careers is that, like the title says, medical careers, you have to go to some kind of medical school to have those titles, where the allied mental health careers do not require it. But that doesn't mean that they're less important. They're just different in nature. Most of the time, the medical careers will focus, like for example, psychiatrists will focus more on medication management and understanding, and they will work together with us, like therapists or the nurses. So we usually tend to work in teams. Rarely you see people work alone anymore. So we all work together because in the recovery model, which I could talk to you for hours, but we will not get to do that today. It is a holistic approach. So we understand that if we don't address the entire health of the person, there's not going to be a change. And for that, it also includes like the universe. So medical, you require some medical school training. For allied, there's a lot of different options that require different levels of education. Then, this field, it's very flexible and allows you to do many things. So when we talk about mental health, most people think about therapy or psychiatrists. And that's not true. For example, in my case, I started in clinic. Yes, I have done therapy. I work with anybody, children, all the way to older adults. But now I am part of administration and education. I do training, which is my passion. I also teach on an undergraduate level. So I love teaching, it's my passion. So I teach psychology, I train my staff, I train students, I do a lot of work with high schools and community colleges, but you can go around and do other things. You can do social work, policy, adjustment, you can work in community advocacy, you can work in forensics, substance recovery. So there's many things you can do. You can work in public health. Of course, I want to promote that because that's what I do and that's what we're here for. But you can also work in private organizations, and you can have private practice. And one thing about careers in mental health that is important to talk about is the longevity of your career. Whereas with certain employment, you have to constantly worry about, will I be able to work in this field for a long time? As a professional in behavioral health, you are your own consultant. For example, I'm a licensed clinician. Should I wanted to leave my current position, I could have private practice and I could work in my private practice until, way beyond my retirement years. So it's very flexible. Opportunities that we have with the county, there's volunteer opportunities, mentoring, internships. We do educational partnerships, which is what we are doing right now, and also with high schools or colleges, and we provide training. One thing to talk about during this time is this flexibility that we're getting with the telehealth. So not only we're providing services through telehealth, like what we're doing right now, but in a secure, specific way, but we're also developing the opportunities to do the mentoring online, which is something that we would have not been able to do before due to time constricting and location, as Riverside County is a very, vast territory. So there's plenty of opportunities. And to do that, there's several different ways to do it. If you want to just find out what jobs are available in your area, there's a website for the county where you can see the current openings and job description. In the Coachella Valley, in the desert, we have a big focus on substance recovery. Most of our clinics there have a very strong focus on that. And there are plenty of opportunities. That is one of the largest areas where we have openings right now. So this is a place where you can check. And also, I'll stop sharing my screen now. We have, I provided Eloisa with some links to our page with careers, what you need, and you can check the job descriptions and a whole bunch of other stuff. But just to close this really quickly, it is fun to work in behavioral health. It may seem scary, but it isn't. And I'm glad that I made this choice for myself. Thank you.
Thank you, Michelle. Next, we will have Vic, who will talk about the post-secondary opportunities in behavioral health. So I will be sharing my screen.
Thank you, Eloisa, and thank you, One Future, for having me. Hello, everybody. My name is Dr. Sharma. I've been a campus director at Brandman for almost a year now in the education sector. I have worked in the medical education for over 20 years. I'm a physician by trade, but I've mostly taught medical students and nurses and allied health, and this is where my passion lies. Michelle has done a great job in explaining and laying the background of how you can progress through behavioral health sector. You can earn your associates, bachelor's, master's, get licensed, depending on where do you want to work, whether do you want to work directly in the medical field or in the allied health sector. People who are interested in a licensed psychology field or social work, that's where I am going to concentrate on. However, I am happy to answer any other questions that you have, given that I have worked in different backgrounds. So first, let me introduce a little thing about Brandman. Brandman's been in Palm Desert since 1979, and it's been part of Chapman system. Chapman was started in 1861, and we have served and continue to serve till today a lot of the bases. We work very closely with military, and a lot of our campuses are either on the base or very close to the base. And that was part of the reason of having Palm Desert, so we can help serve 29 Palms as well, along with the Palm Desert community and overall Coachella Valley. Brandman is a nonprofit organization. Our goal is to get students out there with minimum amount of debt. In the slides that we're gonna share, and I will ask Eloisa to make these available for anybody who wants these slides, and I'm happy to share them with you if you like to. Our graduation rate is really high, and we've done some comparisons with other institutions in our industry. The graph shows 81%. Our students are very happy to stay with us. We work with non-traditional students. They're working full-time. They have families and other responsibilities, taking care of their parents and so on. And they go on to graduate. So our graduation rate is really high. And the second important thing I want to focus on this page is the paying what they call is the debt. The debt, if you see on this is 5.1, that means the default rate, which is the amount of money that's paid back after taking the loan, that's called the default rate. Brandman is at the very low end of our industry. That means students are graduating, they're being employed, they're happy where they are, and they are paying off their debt. So that's a really good indicator for us. Now, what do we do at Brandman? Obviously, we serve students in associates, bachelor's, master's, and doctorate programs. We have 26 campuses all through California and Washington. The degrees that we're highlighting here are in psychology and social work. In our master's program, we accept students with either bachelor's, who have earned bachelor's from a regionally accredited university, or we can take somebody from an associate's, and add them to our bachelor's program and get them to the master's program that way. Now, we do encourage our students to come in with 90 credits. You can transfer up to 90 credits into our bachelor's. That means we encourage our students to go into community colleges, any other regionally accredited programs where they don't have to take too many loans and then come to us and finish the rest of the degree with us. It turns out to be a lot more beneficial for our students. That's one easy way. And our university is very, very liberal about accepting credits. We will review any courses. We will review anything that you put forth to us that it should be accepted. And if we can, we definitely will, just to help our students out. Our master's program as psychology is an accredited program, and we're going through some new accreditation. Hopefully that will be in 2022 or 23. We're laying down the groundwork for that. It's going to start off this fall in September, and good things to come. Coachella Valley will be able to take advantage of that, or the students in Coachella Valley. It's going to be a great thing for us. I can't give any more than that because we haven't shared that with our students first. So out of respect for our students, I will wait till that is done, and then we can give more details to our community, and I'll happily share that with One Future as well. For our social work, we have two different paths for social work. One is called the standard and the other one is called advanced. Now, advanced is for students who've done bachelor's in social work from a regionally accredited school, but it doesn't mean that you cannot come into our social work program if you don't have a bachelor's in social work. You definitely can. It would just be a standard one. That means you take a little longer. I think the difference is about 4 to 6 months. It's about 12 to 18 units. That's the difference. But we do serve. Our psychology program mostly concentrates on family therapy, marriage counseling, and general counseling. And like Michelle said, you can do a bunch of things with these degrees. You can have your private practice, you can work in a group, you can work in nursing homes, you can work at the hospital level, you can work with other therapists. There are a whole array of things that you can do, especially with COVID-19 that has changed our world. There are going to be new jobs coming up based on what community needs. So there might be a little more. I don't know. I haven't seen the projections yet. We're keeping an eye on it on bi-weekly basis, where the projections are going for Riverside County. So far, allied health or medical field all over has increased in demand, but where those demands lie in the allied health field has yet to be seen. So my guess would be that they will increase because our community's need is going to be more than ever, plus because of social distancing and all that. So it is a great field to go into. Now, who should do MFD and who should do MSW? Eloisa, if we can go to the next one. That's completely up to a student. And I have, I'm not gonna read the whole thing, but this particular slide tells you exactly who should follow what path, depending on where your interests lie. Do you wanna serve? Do you wanna work in the public policy, or do you wanna work with an individual family? What are your goals? And if you're still not sure about it, you're welcome to reach out to me, and I will arrange that something with one of our advisors or our Irvine Center, and they'll be able to guide you, not to enroll you into Brandman, but just to help you decide what is going to be your career based on your interest. So I hope I haven't taken up too much of time here. This slide also will show you a lot of the concentrations at the bottom. Yes, right there. What we follow, what the core program is. If you have any questions, I'll put my email in the chat. You're certainly welcome to reach out to me. You're welcome to reach out to One Future and they can get hold of me. Thank you for the time, and I'll turn that over to Eloisa.
Thank you, Vic. Next, I would like to introduce Maria, who will speak a little bit about her career path into a behavioral health career. She currently works for Clinicas de Salud del Pueblo. Maria?
Hi, thank you, Eloisa. Hi, everyone. So my name is Maria. I am a licensed clinical social worker, and I currently work at Clinicas de Salud del Pueblo. Currently, I'm working as a behavioral health care manager for a health home program in our clinic. So we're working with chronically ill patients, so patients that have, conditions like diabetes, hypertension, chronic kidney disease. Some of our patients are on dialysis, chronic liver disease, hepatitis, etc. And some of these patients are also struggling with some mental health challenges like depression or psychotic disorders. So I work closely with the RN, and we have a PCP champion that works with our team, and a promotora and a care coordinator. So it's a team of us that are working together collaboratively to manage the care of these patients. But I've been with Clinicas for about 4.5 years now. I've kind of been, as a clinical social worker, my passion has really been in the healthcare setting. Prior to joining, running this program now, I was doing individual therapy with the clinic. So it's an integrated model that we have in the clinic. It's a primary care clinic. I'm working closely with the doctors there. We're getting referrals directly from them to be able to provide short-term focus-based therapy in the clinic setting, which is kind of a unique setting in the sense that patients can come in and meet with us individually for therapy. But I actually, like Michelle was sharing, I didn't realize that this was essentially where I was going to end up, or the field I was going to end up. My bachelor's is actually in political science with a minor in psychology. So I had no clue when I finished my undergrad. I took a year off. I had to, just to kind of figure out stuff, figure out life. And then eventually, through just the life trajectory, I ended up interacting with some medical social workers over at UCLA. And I just enjoyed and I loved what they were doing with patients in that setting. And lo and behold, from there, I was like, what do I need to do that? And that's how I learned about the MSW program, and I applied, got in, and it's been awesome since then. It's a fun career. It is a lot of work. I think it's a very privileged position to be in the position that we are as clinical social workers, in the sense that we meet patients oftentimes at their most vulnerable point, and people just sort of open up and allow us to step in and walk with them in their journey. So it's very rewarding. It can be very stressful though. So self-care is really, really, really critical. But one of the things I wanted to share that can be a little bit scary as you guys are graduating from undergrad, considering these master level programs, is the debt. That's a real thing, and it's a very scary thing, the debt that comes from that as school gets more and more expensive. But there are a ton of programs out there. The program that I was able to apply to and was able to get my loans forgiven was the National Health Service Corps. And that is a critical, awesome program that we have. It's through HRSA, and it provides loan forgiveness for individuals like LCSWs, medical doctors, nurse practitioners, RNs, psychologists. And as long as you commit to working at a clinic or a clinic setting, federally qualified health centers like Clinicas or Borrego Health in Cathedral City, or Desert AIDS Project. I know the county is also another partner with them. You are able to, as long as your application sort of goes through, you're able to get loan forgiveness for your loans and secure a job for at least a couple of years or longer. So it's just a matter of connecting with people and finding out what resources we have in the community, especially our valley being it's a rural community. There is definitely a lot of resources to help professionals and to help attract professionals here in the valley. So
thank you, Maria.
Yeah.
Ariana just included the link for that in the chat box. And I will also be including it in a follow-up email I will send to all of you who attended this webinar. I will be.
Can I take 30 seconds?
Yes.
Something I didn't mention. Brandman University is completely 100% online, by the way. So given the circumstances that we're in, Brandman University students have not missed a beat a day of instructions or any interruption to their education. So we're very proud of that. So I wanted to mention that I know there are a lot of students that are sending me messages or emails from other universities as well. But I wanted to share this about a very proud thing that Brandman has done of moving our operations from on ground to online without missing a beat. So thank you for that.
Thank you, Vic. I will be sharing my screen one more time to share a couple of resources.
So now I'll be sharing some behavioral health resources that might be available to you. So the first one is Health Career Connection, which is a summer internship program, and it's paid and it's national. So you can get placed in multiple cities, and they have it in the Coachella Valley. So I got connected with One Future because I was their health career intern this summer, and it was a great experience. So I would highly encourage college students to apply to this internship. It's great if you want an introduction to this field. And I know it's mostly health careers, but they also have behavioral health internships, and that's what I did. And I really enjoyed it. So the next one is a Pathways into Behavioral Health website, which is, we've introduced it before, but it's basically a website that I created when I had my HCC internship, and it has all the different pathways into behavioral health, and it'll have resources and links to different programs in the local programs in Southern California that you can do for your master's in social work, marriage and family therapy, nursing, psychology, psychiatry. So you can explore your options and look at programs that might be available to you.
Thank you, Ariana. Now I want to encourage all of you to follow us on social media if you're not already. Instagram, Facebook, and LinkedIn. And we will be having a prize drawing for those of you that attended today's webinar. And now we will also open it up for questions. If you can please use the Q&A feature to ask our panelists questions, or Ariana, myself, I am also an HCC alumni, and we can answer questions about that or about pathways into behavioral health. I will check if we have any questions.
And we want to invite folks to stay on. The webinar program itself was 30 minutes, but all of our panelists have indicated that they're available to stay on and answer questions or with folks for the next couple of minutes. So I know there are some folks that have posted things in the chat. We'll answer those, but I just want to thank everyone for being here today. And if you'd like to stay on, we'd love to have you. I see in the chat, someone had asked about behavioral health resources in the Eastern Coachella Valley. I'm wondering if Maria or Michelle could comment on that or direct people to places they might go for resources in the East Valley.
Well, I'll start. As I shared, we have plenty of opportunities in the desert. The easiest way to find out what is that we have available, if you already have like a certificate or a degree, or you want to know, is going to our human resources website. And then when you go into finding a job, you can filter it by city, so you can see what's exactly available in that area. But you also can, if you want to volunteer, I posted the link for our careers website, and there is a link for volunteer application, so you can also apply as a volunteer. Our volunteer opportunities are not paid, but we have many opportunities in the Coachella Valley where there are different events or support the clinics. So it's one of the areas where the county has more openings than the rest of the county. So in that sense, it's a good thing for the Valley.
Excellent. And what if people want to secure behavioral health services as a client?
So To access for behavioral health services, like at our particular clinic, all they have to do is call. People can self-refer for mental health services at our clinic, and they'll get screened by one of our care managers. And then from there, that person will schedule them directly with, we have a MFT at our Mecca clinic, and I'm exclusively working with the patients in my program, but if they're eligible for my program, then I'd be pulling them in for individual therapy on my end. And so anybody can self-refer to our clinic. They don't have to get a referral from our doctor. They can just come in and request this or call, and they'll get referred to our care manager. But we do have a lot of organizations in the Eastern Valley. There's also Latino Commission out in Coachella. There is also STARS Behavioral Health, trying to remember the name, but they're also in Coachella next to the Food for Less shopping center. So those are a couple of the agencies that I know for us, we refer patients out to if we're not able to meet patients' needs, and definitely the Riverside County, the Children's and Adult Clinic.
Thank you.
Yes. We also, I'm going to post right now, the CARES line call and the CARES for substance use line. If anybody wants to access services at the county, they just have to call those numbers, and they'll direct you, but anyone has access to our services. And also no need of referral, people can just self-refer.
Thank you, Michelle. So we do have some questions now. One of them is, I am currently a junior in high school and will be a senior this upcoming school year. I know I want to do something psychology related, but what should be my next step? Can you recommend summer programs that accept high schoolers? Ariana, I know you touched on HCC. Maybe you can speak a little bit more about that.
Yeah, HCC is mostly for juniors and seniors in college. So that's definitely something you can look into when you hit that age. But I know in my behavioral health pathways website, I did see that there is a mental health pipeline program in Loma Linda, which is available to high school seniors. So I included the link in the chat. So it's on the home page, and there's a mental health pipeline program that's in Loma Linda. So you can check it out. And I know that there's a scholarship available for it too. So definitely check that one out.
I'm just going to add, I just posted in the chat a link to the California Health Workforce Initiative's website. It's www.ca-hwi.org, and there is a tab on there for exploring health careers, and if you click that, it's a booklet you can flip through, and there's all kinds of behavioral health careers and descriptions of those careers, and they've also got activity resources. So I would encourage you to explore that. It's a link to all of the community college programs across the state of California, and you might also explore College of the Desert and their nursing programs. They may have some certificate pieces that could sort of be pre-program that you could check into as well.
And Michelle, I know you mentioned Riverside University Health System takes volunteers. Do high school students qualify for those opportunities?
For volunteers, they have to be 18 and over, and that is just for all sort of different regulations. But Kim, and I don't know exactly the details, but you are connected with the people from Reach Out, which is another organization that works with this, and they do have opportunities. I'm not sure what is available in the desert area, but they have opportunities. They know more places where students who are under 18 may apply.
We also have a volunteer program over at Clinicas. You have to get connected through our human resources department and go through their screening process. I know we have had high school students that have come through and volunteered in our clinic setting. So it's just I think a great opportunity just to get in there and kind of be in a primary care setting and see how that sort of runs, and you'll get access to not just the medical piece, but also behavioral health. So.
I just posted the link for our volunteer program. There's information about the program, and there's also the application that you can check and apply.
have a question for the speakers. So for like graduating students, what entry-level opportunities would you recommend that they look into for this time?
Like, I get so excited about that. Dr. Sharma, anybody else want to answer?
I am not familiar with the entry level. We mostly deal with graduates and doctorate programs. We do teach bachelor's, which is the undergrad, but I don't know anybody coming out of that who has gone into working full time. The only thing I could say is for entry level, you might want to shadow another psychologist or social work and work with them, see what specialty you would want to develop into. For example, somebody I know who's a practicing psychologist out in the desert, they started with an idea of becoming a gerontologist, but as the time evolved, as they worked with other people, they ended up going into family therapy. Someone who wanted to do family therapy ended up in gerontology. So it starts somewhere with an idea, but when you are in the field, my first thing is you have to get a master's. You have to you have to get your license from BBS. Develop your interest at this point, find out where your passion is and what's gonna serve you long-term. Getting into an entry-level position, it's good to have money in your pocket, but for the long run, I think if you're investing, invest in yourself to find out where your career is going to be.
I kind of wanted to share about my experience, like for you to kind of know, I finished my undergrad and I was like, oh dude, what am I gonna do? And I ended up subbing. I was subbing at Desert Sands. I actually graduated from CV High School, so class of 2000. And I subbed. I subbed at CV Unified and I subbed at Desert Sands for a year. I was also volunteering with ICUC, Inland's Congregations United for Change. I did that volunteering as well during that year that I was off, just to, because I knew I enjoyed working with people. I knew I enjoyed advocacy. I knew I enjoyed that type of work, but I didn't really have that sort of opportunity when I was an undergrad. So now here, when I came back home, I'm like, what am I gonna do? I knew I needed to go off to college, but for personal reasons, go off to grad school, but for personal reasons, I had to take a year off to be here with family. And that's what I did, because I had to start paying back some loans. I had to, I had some credit card debt. So and I wanted to help out my parents financially. So that's what I did for a year. And then, and during that process, I started applying to programs. And once I went to USC for my graduate program, my MSW program. And, that's what that looked like for me. I knew I had to take the next step, but I had to, for personal reasons, for my own self-care, I needed to take a year off. And it wasn't subbing. I knew that definitely cemented it for me that I didn't want to teach, elementary and, junior high students or high school students. I love working with college age students, but that cemented it for me. I can't do that. I have to do something else. So that's what it looked like. That's the real stuff. That's what you don't have to really necessarily, it's great if you are able to get access to that. And it may end up being, doing something that you're able to kind of get through until you get to that point. But the volunteering for me, because if it would have just been the subbing, I would have just gone probably mad. But the volunteering aspect of it gave me something that I was passionate about, and it just sort of gave value to that time that I took off, So, and then I went off to grad school and that was over, So that's what it looked like for me. You don't, sometimes you may not have an idea. Eventually things sort of just fall into place.
I also want to mention, when I was talking about, and because I couldn't go into detail because it's just, that's another big area, but we know that in Riverside County, the biggest challenge is, as Dr. Sharma said, is the financing part. And we recognize that our population, most of us will have to work and study at the same time, support our parents, support our children. So it's very difficult. Like I said, I went to school as a parent, already being a parent. But one thing that we have at the county is we have different opportunities because we have some really good incentives for our students. So someone may start, let's say that they start as a secretary in the Department of Behavioral Health, and they get, and this could be right out of college, right? And so they can get their feet wet, try to figure it out. They can start seeing what the field looks like. And then let's say, oh, well, you know, I actually like this idea. And then they can move into a behavioral health specialist profession, which is not a therapist yet, but is under a therapist. And so you start working with coping skills and facilitating groups and so on. And then you decide, well, you know, I've been doing this with children. Turns out that the children is not my thing. Most people think that children's is fun. And then you realize that children come attached to parents and social workers and a whole bunch of stuff. And you're like, no, that's not what I want. And then you go and, you know, it's amazing all the populations that exist and where you will end up liking the most. But you can move around. You can start as a consumer. We have in the desert these amazing therapists, and he's always so kind and sharing this story. But he started as a consumer in one of our clinics, and now he's a licensed clinician with us because we also promote that. We want people in the community to work in the community. That's what the programs like a peer support specialist is, someone with lived experience who has resolve their issues, and now they can go and support other people, share their experience. So you can do this at the same time you study. And if you're studying towards something in behavioral health, we will probably qualify you for a program that we call the 2020, which you get paid your 40 hours a week, but you get 20 hours to go to school and do your homework, which I wish I would have had that, because I was working 40 hours a week, plus 20 of my internship, my traineeship, plus being a mom, plus a school. So it was very mind-boggling, but we have great programs. So there are opportunities. So you don't have to start at, that's what I say, you don't have to start as therapists. You can start as a secretary, you can start as a peer in consumer affairs. We have, I work in the transitional aid youth program for a while, and that's people within 16 to 25 years old. And so you have people who are barely graduating high school, but you also have people who are entering adulthood. And in some of those areas, we had some youth that already were parents. And so we worked with this on helping them transition. So the possibilities are great because you can work and study at the same time, and you can explore these things where you're getting some money and then you are experimenting which area you like. We also have some incentives to reduce your student loan debt, because unfortunately education is very expensive. So it's very exciting. So when I do my presentation with students, I try to encourage them to not focus on the very far end of, oh my God, this is going to take me forever, I'll never do it, because that's not how it works. And like Maria said, you go, you try, you do these things. I actually went to school as an adult. I am a class of 2013, so I not, and I had to figure it out because I had children. And then one day I realized, okay, I'm not going to go anywhere without an education. And then, so there's different steps. Every journey is different. Somebody was asking about school counseling in Brandman. So I'll let Dr. Sharma answer that. But I want you to know that there's another credential that we're not talking about here, which is the licensed professional clinical counseling, which also allows school counseling. So there's a lot of information, and Kim shared their website is amazing. It's amazing what they've created. Ariana created this amazing master chart, which looks like this forensic thing where it's all linked in detail of all the paths that you can follow. But I'll let Dr. Sharma answer that question.
Thank you, Michelle. And I also give out a link in that question and answer for our school counseling. It depends on, I think the question was, how long does it take? Now that depends on a person, how many classes you're taking per term, 1 or 2, And if you're taking any break, I know they have a lot of requirements for the clinical, what they call it, internship work. I think about 1,600 hours where you're working directly with the school in the classes. Sometimes it's part-time, sometimes it's full-time. So it all depends on the person, how fast they want to finish it. You reach out to me and I'll get you in touch with one of our advisors or get in touch with our admission coaches, and they'll be able to answer all your questions on that one. But I hope I give you a brief summary on that, and the link is in the question and answer again. Thank you.
Thank you, Vic, and thank you, Michelle Maria, for touching on the uncertainty that comes in graduating and how you don't have to go in a linear path into a graduate program, because I know sometimes students do wonder what they want to do next. So I think a gap year helps you determine that, and I'm glad to know that there are opportunities for entry level and students that are still trying to figure out where they want to go next. Thank you all once again for joining us and sharing with our attendees. Kim, I'll pass it on to you.
Great. And I, again, want to echo my gratitude to everyone and just put in a little plug. I'm sharing on my screen right now. We talked a little bit about some of the loan forgiveness programs and ways that you can help finance your education. And we have one through One Future Coachella Valley in partnership with Desert Healthcare District. And it's specifically a scholarship for students considering degrees in behavioral health and social work. So I encourage you to apply. The application deadline for this year has been extended to July 31st. This is for upperclassmen in college and also for students in the master's program. So Dr. Sharma talked about some of the programs you can do at Brandman. This scholarship could potentially assist you with that. So really encourage everyone to explore that. And the link is right there with the C2 Nav address. So again, thank you for joining us. Special thanks to our panelists today. You provided tremendous information. We are recording today's webinar and we will be posting it. So please visit it again. We're also in the process of developing a series over the summer. So if there are specific things that you would like us to cover in that series, please post that in the chat or reach out to one of us via email, because we want to make these responsive to the needs that all of you have. So with that, I'll just say thank you very much for joining us, and we hope to see you next time when we host these webinars again. Thank you.
Thank you, everybody.
Thank you.
Thank you.